Hi everybody. It's Victor here. Hope you can hear me. I'm here with my dear friend Antonio. we
Hi, Victor.
will hi. We will talk a little bit about the Portuguese healthcare system for you guys. And I can see here already that there are many people here uh, and some familiar faces as well. Let me see. Of course, there is Lila on the back end, but Dinkar. Hi, Dinkar. Wendy is here as well. So Carlos, uh, Christina from Texas, Dallas. Hi, Christina. Nice to nice to meet you. We will just wait for a while until everybody can join this webinar. So, hi Dolores, if you can tell me where you are from here in the chat box, that would be fantastic. Just to get an idea of the nationality and where you are based.
Do we have
Uh,
do we have a prize for the one who's the furthest away or with the most awkward time zone?
exactly, there's very important to consider. So people from South Africa, South Florida. So this one seems to be a very popular topic. Oh, Marian. Hi, Marian. San Francisco, India. Oh, that's nice. Abauna. Hi. Yeah, people from everywhere. But I guess the majority of you guys you're from the USA, as I can see here. Bruce. Hi, Bruce. Glenn. Oh, that's nice. See so many familiar faces here. Dolores again from Canada. Oh, that's nice. Yesterday I was with a client from Canada. You guys are awesome. Um, we will just wait for some few minutes to so that everybody can join. I guess you guys received one email to join this webinar. This one will be very, I would say, with very important information about the healthcare system here in Portugal, and a very popular one as well, because there are many tips that we will give to you guys, and of course a good solution for some of the challenges related to the Portuguese public healthcare system.
Victor, can we just double check that everyone is able to see us and hear us well?
Let's see, and if you can hear us and see us, if you can just type on the comment if okay.
Okay. Yeah.
Amazing. Perfect. So I guess I will start the this webinar. We will share some slides with you uh, to address this important topic. I will start the presentation, then my dear friend Antonio will also talk about the one very interesting solution for healthcare here in Portugal. So let me see if I can share my slide presentation over here. Lila, if I do anything incorrectly, please let me know. You are my back end, so sometimes I mess things up here. Not so used to use this platform, but guess she's covering me. Okay, guys. So let me start here. We will talk about healthcare in Portugal, such a popular topic. Of course, there are many questions that are related to this topic, and we will try to cover all of them. You'll have a chance to talk a little bit about the to ask questions for us. So try to not spend too much time on the presentation to give you time to talk to us as well. So, firstly, let me present myself. Um, I'm Victor. I'm one of the founders of Viv Europe, and we are a company that helps people navigate the relocation process to Portugal. I consider myself a immigration helper. I've been working with people from all over the world who are looking forward to move to Portugal. So I know one thing or another about the immigration process. Of course, you can always reach out to me if you need any tip or if you have any questions. I'm also an immigrant. As most of you are aware, I am Brazilian. I came to Portugal 6 years ago. Just recently applied for my citizenship. Hopefully, soon I will also be a Portuguese citizen, such as Antonio. And it takes some time for the process to come to an end uh, when you start the citizenship process. But I'm waiting anxiously for the end. And of course, I love the country. I love the food. Love the people. Um, I don't intend to move back to Brazil. I just found the place where I want to spend the rest of my life. But who knows? Of course, hopefully, uh, I can stay here for many years uh, ahead. So this is me, and now I will let my dear friend Antonio to introduce himself. Then we can start. Can you go ahead, Antonio?
Thanks, Victor, and thank you so much for the invite and for allowing us to present ourselves, but also to have me here on board today. So yeah, just a bit about myself. I'm a nurse from background. I did grew up a bit in the U.S. until I was 7, but most of my young life was all in Portugal, more specifically in the Azores, where it's a beautiful place to be. So if you are planning to go there, even or to relocate there or to live, that would be a great option. And we'll be here to help you with any questions you may have for that. But yeah, career-wise, I work mainly in emergency rooms, cardiothoracic surgery, and then I moved to UK, where I worked basically in a big um, medical assistance company, helping people access medical care throughout the world. And I think that's where kind of like I developed this special interest in this sort of subject, and I think that's probably what leads me today to have found Algarve MedAssist, which is a medical assistance company providing home health services throughout throughout the country. Um, but with that as well, we provide kind of like medical concierge services in the sense that we are more than happy to provide any support or ask questions that people may have, especially for someone who is on your shoes, to wants to move to a different country, is not really sure what to find. So that's where really we want to put ourselves. I've been an immigrant myself. I lived in the UK, as I said, for 10 years, and I know how it is to move to different countries and not sure what you are going to find, how to navigate the system. So I kind of like can feel your anxieties and your concerns, and I think that's why we would be a perfect fit to to support you or to at least be by your side. Um, this is supposed to be an interactive webinar, so when either myself or when Victor is speaking, feel free to ask questions and just to make us feel at home. Feel free to ask anything.
Thank you so much, Antonio. Very nice having you here. Really, really a pleasure. It's the first time that we are covering healthcare. I was so happy to see so many people
Yeah, sounds like the stake is
enrolling.
quite high today. So let's see if we can keep the expectations.
Yes, hopefully we can deliver good content. And just briefly before we start the main topic, uh, today the star is Antonio. He knows uh, about the topic. I will just go very briefly talk about the public healthcare system, mainly about my experience being an immigrant in Portugal. What was the challenges that I had to face, and thinking about the challenges. That's uh, one of the reasons, of course, that Antonio uh, decided to create the company. He will talk a little bit about the process just up next. So very quickly about Viv Europe, we are a relocation assistance company. We help people from everywhere to move to Portugal stress free. Try to be um, as close as possible to you guys, despite the fact that we are, of course, working remotely. But we try to be as personal as possible. We guide you, of course, during the whole process of immigration. So, be it for creating your tax number, bank account, accommodation, shipping. So, all of these activities that comprises the relocation process, we can help you guys. Just go over on our website or contact me. It will really, really be a pleasure to help you out in this process. So, without further ado, let's move on to the main topic. We'll talk about healthcare system in Portugal. Focus on immigrants and what do you need to have to be able to be assisted in the public healthcare system here. First of all, you will need the número de utente. So this is your public medical number that will allow you to use the healthcare system in Portugal. Not everybody can have one. There are some rules to apply for it. I will talk a little bit about this in the next slide. But this is the first stage, getting your número de utente number. After that, you need to find a local medical post where and each city has its own um, posto de saúde, how we call here. And this is the place where you will register, and it's linked to where you live. So depending on where you live, you will go to a specific local medical post, and there you will be assigned a family doctor, médico de família. This doctor will be your point of contact here in Portugal and will be responsible for your medical history here in Portugal. So if you're lucky, you'll get a friendly family doctor. I consider myself very lucky. Me and my wife, we got some very very nice people as family doctor, and this person will assist you during the time that you're living here in Portugal. Of course, if you move to another city, for example, then you may have to change your family doctor. But usually, this person is the one who knows you, know your medical history, and will be with you during the whole process. Um, and of course, you cannot just pop up in the uh, hospital or in the medical post and get attended by a doctor. You must schedule your appointment beforehand. So to be attended, you need to schedule your appointment. They will let you know when. you have to be there for your consultation. Okay, this is roughly how it works here in Portugal. It's simple, it's well structured, but of course it comes with challenges. And the first one, and of course, this is my personal experience. Maybe Antonio have another view, but I can see that many immigrants, they in the recent years they decided to move to Portugal, and usually, if they are in a legal situation, they can have one family doctor. But there are many people, not so many family doctors. So nowadays there is a lackage of family doctors to take care of everyone living in Portugal. So if you move to Portugal, depending on the place where you will be living, this situation can change a little bit. There are places where there are more family doctors at your disposal. So in other places, not so many. For
Yeah,
example, yeah, in
yeah.
this
Sorry,
city.
yeah.
Do
Sorry,
you
Victor. I
agree?
didn't want to interrupt. Didn't
Go
want
ahead,
to
please,
to
please.
interrupt you there. Sorry. Yeah, I mean, it really depends where you are and what is the infrastructure there. We will see that big cities access is one way. Probably if you are more in the interior of the country, it'll be more remote areas. It will be different. But the concept is that the healthcare system works around your GP, your family doctor, and he's kind of like the one that would be responsible to see you every time that there is a problem. Of course, there is a huge shortage, and there is not a doctor for to be allocated to each family, and that's where the issues come. People have to queue up at their center de saúde or their GP practice for long hours, or they have to go. They only have, let's say, six slots available that day, or if you are lucky, 6 in the morning, 6 in the afternoon, and if you are lucky, if you get one of those six, it's kind of like winning the lottery because it means that you got it, don't need to go back. Otherwise, some people have to queue there for a few days. So, unfortunately, the public system is very varied depending on where you are, and it has its challenges to access. But as just to highlight on what Victor was saying, your número do utente is basically kind of like your ID for any health matter problem. It follows you from the time that, for us Portuguese born here and living here, it will follow us from the time we are born, let's say, until the end of our lives, because that number will identify us in everywhere related to healthcare and a bit as well with the social services. But it is a key step for when you can obtain it. Um, yeah, I think that will be for now.
Thank you, Antonio. And I agree with you. Also, there's a queue, as Antonio mentioned, and sometimes if you get an appointment, you do have to wait for a while. For example, my next medical appointment, it will be only in June, and I tried to schedule it on February. So I'll have to wait for a while. It's not only me, of course, it's an issue uh, that is related to the structure.
Yeah,
But yeah, it is what it is, right?
and then you probably will hear sometimes that people, certain places have a different structure of their family doctor practice. Um, what we've been describing is very much the old system where it how it's been run throughout the years. Lately, there has been some sort of initiatives to change things, and some of these doctors are kind of like invited to kind of like set up a model where it's kind of like is run as a private clinic. So you basically get appointed a doctor and nurse and an admin person, and they follow your family throughout your life cycle. And you will see, because there is a bit of an incentive package behind it, things are a bit more smoother and things run in a bit different. I am fortunate to be on one of those, and I still have to wait for a month for an appointment. Of course, because if it is a condition that can wait, it's fine. But there is then kind of like strategies that you can. There's kind of like backup plans if there's something emergency that you can follow through as well. So just want to just not too scary at all. It's just to show you and set expectations what to expect from a from a public healthcare system. Of
Okay.
course, it is reliable, it is secure. They will be there for you. No one is going to be turned away, and I think that is the key message here. I mean, um, things. No one is going to walk away because they don't have care. It is just if you're coming from a Central European system or from an American health system where things are quite swift and quite quick, don't expect that from the public Portuguese health system.
Thank you, Antonio. I totally agree with you. So, talking about those who can request a family doctor, as I mentioned before, not everybody can be appointed a family doctor. There's some requirements. Certainly, all Portuguese people can. Being a Portuguese citizen uh, allows you to have a family doctor. Legal residents in Portugal also are allowed to have a residence family doctor as well. There are some countries where you can find some agreements uh, with Portugal, and these people from this country also can ask for a family doctor when moving to Portugal, even without having a residence permit here. Brazil is famously one of them. There is a document called PB4 that allows people to register in the medical postal office, and also refugees and people who seek asylum. They can also be appointed a family doctor. Again, there are some maybe there are some struggles to get one. As we mentioned, it's not that easy. There is a queue. So, but these people they are allowed to have a family doctor. There is only a situation where some people they apply for for a visa, they are granted the visa, and then they move to Portugal. In Portugal, they are just waiting for the appointment at what used to be CEF. Now it's IMA, for them to get the permit. So this is just this final step to get 100% legal in Portugal. But as we know, uh, sometimes it's not easy to have this appointment at IMA. So they stay in Portugal in a very awkward situation where they cannot go apply for the número de utente because they don't have the residence permit. But it's not their fault that they are in this situation. They want to get legal. So this situation is very complicated. Um, Unfortunately, some of them will have to wait for the appointment at IMA so that they can later on apply for the número de utente. But overall, these are the people who can apply for the número de utente and be appointed a family doctor here in Portugal. Just out of curiosity. So if you are just a tourist, tourist in Portugal, for example, you will have to use the private healthcare. You have to pay. Um, okay, very. I'll go very quickly on the structure from my point of view, and I do agree with Antonio. It's a well-structured process here in Portugal. The system works. There are these challenges, this situation that may impact how quick you will be attended, but you will. A doctor will uh, be with you on a consultation. Uh, so overall, the system works here in Portugal. My family doctor is very friendly, and when I talk to my friends, they all say the same. It's very hard to get one. It's hard to get an appointment. But when you are there, these doctor usually want to know a little bit about yourself, what you do on a regular basis, if you exercise, maybe even tell one joke here, one joke there. We'll even talk about nutrition. So it's a very, I would say, complete analysis. They will want to know specifics about you, and everything that you say will be recorded on your medical history here in Portugal. And this for me is fantastic, because just for example, I just moved from Braga to Porto, and now this new family doctor that was appointed to me knows everything about me without me having to explain my situation once again. So it's very connected. The system works very well in this regard. uh, do you agree with me, Antonio, that
Absolutely. They have what we call kind of like a sort of an integrated system. So, and kind of like your family doctor is the one who's kind of like at the head of that system. And again, everything goes back to them. So they should be the ones that uh, see you often. Are they the ones that are going to refer you to specialists when needed? They are the ones that, if let's say if you have to have if you have to go for on long-term sickness, they are the ones that are going to be responsible to issuing you that document that you can present to your employer, and then of course follow you through that process. If there is a big catastrophe, like a health catastrophe or something more concerning, he's the one who's going to be kind of like guiding you on that process. Um, at the same time, uh, if you have to go to the public hospital, and of course your discharge letters from the hospital are going to be sent to him automatically, they should be able to get in the system and see your health records from the hospital. They should know if you had any sort of admissions, or what medication you are, or how often are your medication being prescribed to you. So there is kind of like an integrated form of finding that information out. And again, this comes all back to having the your TENTI number. So that is kind of like the key for all this magic to happen. In regards to what you were saying regarding doctors being friendly and doctors being knowing all about you, let's say that it's a lucky dip. We all love our days, but
yeah,
there is a huge generation of new doctors, like a new generation of doctors that um, are focusing more on the person itself, and that is very noticed between your fellow expats that are coming. You came already. This is a common theme that I see when I speak to them. Um, and yeah, that I was going to bring that up. Yeah, but I mean, they know, and oh, I don't know what I want to say. Regarding they talking about your diet, your exercise. Of course, this is a system that is run by the public system, and there is kind of like programs to develop the communities, to implement the community. So healthy lifestyle, exercising, the healthy eating, all that are things that are coming together as programs like dictated by the Ministry of Health that should be implemented. And of course, there is then kind of like they link back to the needs that the person has. So it becomes kind of like a normal conversation as a way to implement these health programs in the community. Um, and that's where I'm glad that you found it kind of like as it was a natural conversation, but there was a medical drive behind that just to see how you are and to, of course, implement that agenda, which is supposed to be in the is supposed and it is in the interest of all the community.
I agree. It's nice to see so many people sending messages. It's like first time that I see this quorum so high. Thank you guys. We will answer your questions in the end, so you can feel free to just uh, comment here if you need to know something. We will go over, try to go over most of them when when we finish it. And yes, I moved to Porto. I see that many people, Lisa, for example, is telling that we are now neighbors. That's good to know. Let's do something together, Lisa, one day. And talking about challenges regarding the structure, um, I, s- I s- you know, it all comes back to the how uh, overloaded the current structure is. So this is the distribution of hospitals and postal and medical offices here in Portugal. It seems that they are many, but I would say that especially if you go to the big cities such as Lisbon, Porto, the population there is much uh, bigger than the.
Dense.
Yeah, exactly. It's much denser. So there is a need to work on that area, create new facilities, new hospitals. For example, when I used to live in Braga, the Braga hospital was responsible for uh, all of the surrounding areas. So if you lived in a city nearby that there was no hospital or even postal or even medical service, you would need to drive to Braga, and then that would make Braga hospital overloaded with patients. So this is something that needs to be seen by the
Yeah, I would
government.
say that something needs to be considered when you are choosing the location you're going to, especially if you already have some sort of underlying medical condition or need for um, a chronic condition that you are already suffering. And just look at the map. I mean, actually, it's interesting that the way you put it there. But if you look at the Algarve, so that bottom block there, there is two hospitals only. So you have the one in Faro, which is a public hospital, and then we're talking about only public system, guys. Don't There's
Yeah.
more hospitals in the private sector, but in the public system, you have one in Faro and one in Portimao. They actually work together. They are part of like the same company, and they work together. So if there is, like for example, Portimao is kind of like a smaller hospital, so when there is a need for upgrading care, it would come to Faro, which is right in the middle, and then they would go up to Lisbon. So this is kind of like something to bear in mind, is that these public hospitals, they work as a network. So if it is getting if the patient is deteriorating and if they need to escalate in the care, they would go up to the next level. So Faro would then escalate to Lisbon. And it's often that we hear someone had to be either flown by helicopter, depending on the emergency, or taken by ambulance to up to Lisbon. I had a client of mine, also an expat, that he had a very concerning vascular problem, and he was taken by helicopter to Lisbon, and and their 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 description of the event was quite very positive and very reassuring. So there was someone asking how it works in terms of an emergency situation. That's the key message that we want to provide, is that if it is a real emergency, they are not going. No one is going to be denied care. So you are going to be seen at the hospital, or at kind of like at what we call subs, which is kind of like a small emergency unit that they have an ambulance on their side. And if it's something that is outside their scope of practice, they will then take you to the hospital, and then you get into the normal system. Um, I'm not sure if you heard of our road network here in Portugal. You have to pay when you go on the highways, and there is something we call Via Verde. Means there's like a small stick that you have in the car, and that it allows you to pass through without paying. In the hospitals, there is something like that. So when you call the emergency service, which will be the 112 as throughout Europe, um, if they are suspecting of a heart attack or a stroke or a sepsis, whatever it is, when the ambulance crews are calling into the hospital, they know they already know that a critical case is going to come in, and they start getting these people lined up ready to take care of it. And that's kind of like on the same route as you have on the highway to pass through. You have that in the emergency rooms, meaning that if they know that you have a stroke, someone coming in with a stroke, they will channel things that you get quick access to the right means into the right teams. The same with heart attacks, the same with sepsis, and therefore. Um, Looking again at the map, um, you have, for example, between Algarve and Lisbon, you have only one big hospital. That's Beja, which is kind of like more into the interior of the country. And again, they have their own limitations. So again, they will be upgrading to Lisbon, and it's because there is an emergency medical system that coordinates all of this. They are the ones who dispatch the emergency ambulances, the rapid cars with doctors and nurses on board, and the helicopters. So they are the ones who make that work, and that's why in sort of an emergency you will always be taken to a public hospital. No matter what you have, if even if you have a private insurance, it doesn't matter. If you called 112 and if they deemed it was a real emergency, they will take you to the nearest public hospital, and then from there you will be followed through the the steps that are required for that, as if private healthcare did not exist. If you feel like you don't want that system because it's not an hotel. It's not the Hilton, of course not. Um, or because you may have to wait for a surgery, for example. It's not unheard that you have a hip fracture and you have to wait for a few weeks to have your surgery. You can then decide to be moved into the private healthcare system, and that is fine. That is possible as well. But just to answer someone's question about how does it work in emergency, no one will be turned away, and you will be taken and you will be seen, no matter if even if you are a tourist or if you are waiting for your visa or your residency. It doesn't matter. You are seen as a person.
Thank you so much, Antonio.
Welcome.
Um, so yeah, this is the distribution. I did point out another challenge about the system that can be the language barrier. Um, Talking for I of course I speak Portuguese. I never had to face a situation in this regard, but I do have clients that they tell me that there is a language barrier sometimes, depending on the doctor that will be with you. As Antonio mentioned, there are many new doctors arriving in the system. They tend to be more. They tend to know more English than the the elderly. That they more like the old doctors. So you can face a issue depending on the person who will be appointed your family doctor, or even in hospitals, for example. But that can happen. Do you agree with me, Antonio?
Absolutely. It's a bit of like of as a matter of luck as well. Um, we also see as well. I mean, a lot of especially the younger generations, like myself, they worked abroad for a few years, then came back. Of course, you'll be sure that that person will speak to you in English. But again, if you are with a team that is a bit more have an older generation, or they may not even have not just because they are older generation, they don't have the language capability, it will be more challenging. However, I think the good thing about the Portuguese is that they always will want to find you a solution, and they will even speak
Yeah.
to you in gestures. They will try to make a drawing if needed, or they will find someone around who can help, come and help. Of course, is that going to be a clear uh, a clear speech or a clear conversation? It may not be. So just be prepared for that sort of differences that you may find, especially in the public system, which is already very run down, very busy, very demanding for the teams that work in these environments. So they may not have that extra time to go through. You may question, but that's key for the success of the treatment. It is, but for them, it is not their priority at the moment. Doesn't mean that they will not come back to it later, but at the moment, you may not have that. Nonetheless, if it is something critical, usually the doctors are able to speak. they are able to give you kind of like the key messages, the key points of your treatment plan and what you need. One thing that we see quite often as well, I hear quite often when I go into hospitals and see people try to get medical updates and try to see what's going on, is that, oh, I didn't see the doctor. I spoke to him just 5 minutes ago. He knew everything about the patient, but the patient perceives that they haven't spoke to the doctor because there is probably a bit of a cultural thing that there is not that time to actually spend 5 minutes with the patient. It can be quite left for a second plan, where it really, again, it's a bit of a depends where you are. I
True.
had a patient recently who was admitted, and she was under like the care of two teams. From a neurosurgical perspective, she had no idea who was the doctor and what was going on. But from her ENT doctor, she knew who it is, and they because he came in and spoke to her very often. But actually, the neurosurgeons were the ones that were kind of more involved. But she could clearly see that it was kind of like completely different hospital, a different department, because they were not as forthcoming with information and so present as the other ones were. So just bear in mind it can vary. Now, again, just want to emphasize that the quality of the care is there. What you need will be there, and they will be safe in the way that what they are providing to you. Especially if you are in a hospital, be prepared. Sorry, in the public hospital, be prepared for a room with multiple patients. Like some people waiting on stretchers on the corridor, for example. If you go to the emergency room, waiting for many hours to be seen by the doctors. Of course, they have the what we call the Manchester's triage, which is a system which will give you a color when you come into the hospital to be seen, and that will then dictate what is your priority to be seen. Of course, if you have a red or an orange, you will be seen immediately. But if you have a green or a blue you shouldn't even be there. That's the first point. But a green may have to wait for many hours. So again, bear these things in mind. And because if you are waiting, it's because they are busy. And as the time goes on, the teams are more stretched, are more busy, are getting tired. So then the capacity to answer for things that are a bit more customary may not be there as well. So just that bear in mind. But I can assure you, they will do the best they can to try to help you.
They will. They certainly will. So just coming to an end for this slide. Many people ask if the people and the expats in this instance, if they need to have a private healthcare. Um, in terms of the immigration process, nowadays it's recommended for you to have one private healthcare because they can ask for it in your appointment at IMA. Okay, so this is just to consider that is important for the relocation process. Uh, but of course, we will talk a little bit about the um, Algarve MedAssist, and you can see that having a private healthcare is not the same as having free access to doctors. There are some, I would maybe issues, but there are some specifics about having a private um, healthcare that is, sorry, I'm talking about the insurance, the private insurance that is sometimes you will have to wait to start using it because there is the famous grace period. So you have to wait for a while until you can start using your private insurance. And either way, having one or not, you need to go to the hospital. There is a need for you to be there, to wait in the line, to be attended. And of course, you will pay less if you go to the private um, to private institutions. So there is a good side about having private insurance. So you pay less for your consultation, but of course, it's there are also the cons because either way you have to move there and you have to wait in the line. But and you in the unlike Brazil, for example, where when you do hire a private um, insurance, you will be able to go to any private hospital or private medical post and be attended for free because you did pay for the insurance. Here in Portugal, it's not like this. You still have to pay. Of course, it's much less than paying for the full consultation, but you still have to pay a certain amount to be attended. So just want to put this in perspective because this is a very common question.
Yeah, depending on what, so basically it depends on what sort of membership you have with that insurance, and of course that level of membership, as any other insurance, would dictate what are your co-payments for each sort of intervention that you receive. So some insurance may say, if you actually have like let's say a gold membership, I'm just making it up now, but you probably will pay €1. But if you have a lower plafond, that means that you'll have to pay €30 for your emergency room visit. So it depends. Putting into context, overall, the cost paying the €30 is still just a fraction of what you would pay if you went to private. Some hospitals for the emergency room visits, they are charging as a bare minimum at least 80 to €100. So if you're just going to pay €30, you're already earning money, saving money there. But it really depends on what sort of plan you have. Someone asked about, do Portuguese people have a mixture of both? That's true. They have. Of course, everyone has the public system, which we say is universal and tenancy free, because we tend to the back in the good years, let's say, it was no co-payment at all. But now these days, there is a small fraction that you have to pay if you don't have any problem or any disability or any chronic conditions, you have to pay a small amount. And there is talks to get that away. um, but even though the majority of the Portuguese population, and that has been quite scrutinized lately, especially during the last elections, more and more people are adhering to the private systems, and that is because there is the sense that the public system is not enough to cover all your medical needs, or the timing may not be there for you. Let's say that you need like cataract surgery, the waiting time may be quite long. If you need a heart surgery or even just a heart appointment, heart cardiology consultation, the waiting time within the public system may be beyond what you are willing to wait, because of course it's your heart and you want to get it sorted. So that will be a driver for you to go to the private system, and of course having the insurance will be a bit may make it a bit more appealing, if I can apply that word here, to have the insurance so you can have quicker access to healthcare.
Exactly, my friend. Thank you, Antonio. So, as you were able to see, the public healthcare system is indeed good. The structure works well. This whole system works, and that's actually one of the reasons why people choose to move to Portugal. So they want to have a good healthcare, be able to be attended on a good healthcare system. It's certainly a concern, one of the most important concern when choosing the place to relocate. But there are still many challenges, as you could see, and to cover these challenges, I will now uh, let my dear friend Antonio talk a little bit about the his company, Algarve MedAssist. We've been having such a nice partnership with Europe and Algarve MedAssist. We are very lucky to get to know. I'm very lucky to get to know Antonio, and but I will let him go over the details about Algarve MedAssist for you guys. Let me just
And
change that.
thanks, Victor. And actually, I was thinking early today, how did he actually met? And I then remember that it actually was one of your partners that I came across her because she was looking for a house call doctor, and then I kind of like offered, here we can help you. And then when she saw the service, oh, let me just put you in touch with Viv Europe, because I think this would be a nice contact for them to have for fellow expats. So that's how it started. Um, but as I said at the beginning, I mean, our government assist is a company we founded in 2000. 2019 by myself with a nursing background, but had always this desire to ensure help people access to medical care. I think it cannot be it is a very strange feeling that you need help, you need support, you don't know where to go to. So that's where we come in. Algarve, because we set up ourselves in the Algarve, um, but we actually cover most of the country, mainland and islands. Um, can you just move down?
Of course. Just for instance, Antonio, are you able to change the slide as well, or just me? If you
I don't
scroll,
think
okay,
so.
no, no worries. Like,
I just have a normal view. Just come down a bit more.
okay,
Another
so
one.
you can let me. Okay,
Another one.
we know.
Okay, here. So this is our team, and I actually can see them, some of them in the audience. So thank you for joining us, joining me actually. But yeah, our team basically what we have is doctors, nurses and midwives, psychologists, physiotherapists, and some hospitals that we partnered with. So the idea, what we want is kind of like what the idea behind is kind of like we are like a port of call for support, especially while you don't know the system, don't know what how to. A simple question sometimes can take you away a lot of stress and a lot of concerns because actually you had someone who pointed you in the right direction. To us, it's not about how many appointments we sell, how many appointments we did. It's also as well, of course, there is a business side of it, but also what we want is to make sure that people are are um, are well received in Portugal when they came over as well, just to help them to set themselves up and to navigate the system. Can you come down one more? Next slide.
Thanks,
Victor, can you
Juan.
hear me?
Thanks, Antonio. Yes, I was facing some internet
Okay, no worries.
issue here, but now I can listen to you.
Yeah, no worries. So yeah, I mean, in terms of our partners, we have the Kuch group, which is a bit throughout their country, Lusíadas as well. Then we have as well partnerships with ground ambulances and ground transportations. I usually say that we can book you an appointment at the hospital, and we actually can help you to get there as well. You just need to make sure that you are ready at the time of the appointment. We will find a way to um, to uh, to get you there. We also have some partnerships with hotels. So when you need to, especially if this is more for our tourists that came over, got sick, and then we are helping them throughout their recovery process or before they return to their home country. We do have some partnerships with hotels to help them for that initial stage. Then we have some sort of like agreements with wellness companies, spas, and yoga retreats. Um, there is as well. Let's say that you were admitted for a long time, you had pneumonia, or you had something a bit more concerning like a heart attack or a stroke, and you're not able to look after yourself. We do have as well companies that provide care that we can provide that to you and refer them to them. Usually, what would happen is we would work as a case manager, and then we coordinate all the care that you need, especially being either a nurse or a carer. We can provide that, and at the same time send a physiotherapist or send a nurse to do to check on you, make sure that you are following the normal recovery process, and therefore. As well, that's another agreement we have as well with the oxygen at home companies that we once we have a prescription, we can take care of it for you and just make it a simple process for all involved. Our position is that whatever is you need, we'll be here to support you, and you shouldn't have major challenges to access your healthcare. Can we move on to the next one?
Thanks, buddy.
Yeah, next one.
Next.
So yeah, this is kind of like one of the projects we implemented probably like 6 months ago, which is about the online appointments. So sometimes as we talked about, sometimes it's not easy to access the healthcare, or you don't have any insurance, or you are not sure what to do. um, we do have in our team, we have nurses, we have general practitioners, we have psychologists, um, and we also have a midwife. I usually joke we don't deliver babies on online, but if someone is coming over and is planning on having a baby and wants to have a midwife to follow them through to support them with their pregnancy process, we can also have that process. You will see that, and if you actually do the QR code, follow the QR code, you will be taken to our online booking process, and you will see that there are some appointments that are there for free. These are given to Viv Europe's members, and the idea is that we are available to discuss any concerns or any questions you may have regarding your move over here, or for any specific questions that you may want to answer in terms of your own health. This will be available for the next month, just a few options here and there. So you're welcome to book in and to use them, and we can help you with that. Um, in terms of the other ones, this will be an online appointment for with, let's say, with a GP. Yesterday, for example, I had one of my clients that he's staying in a quite in the mountains. Apparently, looks like he was bitten by a mosquito, but he had a very bad reaction. I did a first call with him yesterday, saw some pictures, and I wasn't very happy with how it was, but I gave him some initial advice, and today I followed up again, and things were not looking better. So I actually booked an appointment with a doctor, and he prescribed him right away with some accordingly to what he needed. Um, so this again is kind of like a quick way to access care in a secure and safe, in a secure and friendly environment where you are going to be followed through. Again, that health number that we were talking about is key because the doctor needs to give you a prescription. They can input that number in. That will bring your file up, and they can prescribe your medicines. If you don't have that number, it's not a problem. We can still do the prescription, and it can still be used as normal. The only difference is that you will not have um, the medicines itself would have a different price if you are a resident. So that is kind of like the difference of having or not having that number for this context. But yeah, this is kind of like an easy way to access care and to answer those immediate questions that you may have. Can we move on?
Yeah, also I had the chance to Antonio had the chance to make a like a demo for me in regards to the system. It's really, really, really very responsive, very friendly, very easy to navigate. So I guess you should just go over to see if it works for you. But it's very, very well done.
Thanks, Victor. And it does work. We have proven the concept that it works, and I think as well the fact that sometimes just the fact that you know that you have a medical professional by your side for that quick question, quick concern, they're not sure what's going on, we can certainly make that difference, even just to bring peace of mind and some reassurance to yourselves.
Okay, let's go the service.
So yeah, here are the main services that we would provide. So the house call, so the online appointments, but also if we think that for this sort of situation, actually, I think you need to have a proper doctor consultation. They need to listen to your chest. They need to see you properly. So we would send a doctor there to your home. Um, Another option is as well is that if you are, we can make your appointments and sort out the guarantee of payment. That's what GOP stands for, guarantee of payment. And we can kind of like do that process. So when you come into a hospital, they know you who you are. They know what you are coming for, and the process is much easier. This also gives you the option to, if you do have any insurance, you can still use it. So you will just take care of your copayment at the time. If you don't have any insurance, we will take care of that to you, and we will then just pass on that bill to you at the end after you've been seen. The discharge planning and follow-up support. This is more kind of like um, to give you some peace of mind when you are, for any reason, you have to be admitted. The transition from the hospital to the home environment can be quite challenging, quite overwhelming. So the idea is that we can see what's going on and help you make that plan to see what you will need, and make it kind of like a more of reassuring and hassle-free assessment process. Sometimes as well, I've seen. I mean, I did had one of my clients, a few of my clients actually admitted in Lisbon recently, and when I'm there, I just pop into the hospital and see them as well. One of them, of course, is they're my clients, and I want to show them what we are here and to give them some reassurance. See, there they are, but as well as kind of like that preparation phase that we are trying to put a step ahead as well. So that really has made a difference, and is kind of like a cherry on top of our service. Let's say that you need to return home, or actually no, this one is more for ambulances and ground transfers, meaning that let's say that you are in a situation that you actually need an ambulance to go to for your appointment, or to go from point A to point B. We do have our network of ambulances that we work with, and that we can facilitate that process. Sometimes we also can use them to, let's say that you need to be transported back to France or to Germany. We can help you with those long range transfers. The same happens as well with kind of like just a normal transfer on day to day. That's an option that we can offer as well. Then the last one will be repatriation and medical escorts. My background, I have done multiple repatriations, different places in Europe, in the US, South Africa, therefore. But this is kind of like a program we have to support companies that are doing that, and that need boots on the ground to move their clients. So this is what we that line of services is for. We can either go to the hospital, see how things are going, and make sure that that person is then safe to be transferred back home. Other thing is as well, we may actually accompany that person back to their home country as well, depending on what the insurance wants or whatever the client wants us to do. Going back home when you are quite fragile, or because you had a recent big surgery, or you need some sort of someone to help you, give you make interventions throughout the journey. This is where we would come in. In general terms, I mean, that's really Algarve MedAssist is what we want overall, is to bring an extra layer of expertise, an extra layer of help, especially for you guys that are probably making a big decision to move across countries and to settle up a new life. Sometimes not knowing what to expect, not knowing what how to navigate the system. That's really the message I would like to put out there, and that we will be more than happy to support you guys. Victor, can you hear me, Victor?
Thank thank you so much, Antonio. Yes, I can hear it. I don't know what happened with my connection. There were some times where I sometimes was
I was on
like a
full screen
glitch,
as well, so I think you were
but
frozen
I
for a
was
long time. That's why I
was
wasn't
able.
sure.
I'm here. I'm here. We are running out of time. But we can go over the most important slides, Antonio, and then we can just move on to the questions. I can just go over the slides. If you think that there is one that's like very
No, no.
important, you can
I
just
think we had. I think we talked about us. I think let's give them an opportunity to the audience to make some questions and to answer any specific
okay.
that they
And
may want.
also, guys, just so as you know, this presentation is being recorded. You'll be able to watch it again when we want to. And it will be published on our Facebook group as well. So don't worry if you have to leave. I see that some message that people are needing to leave the presentation, the webinar. So no worries, we will be able to show it to you later. Okay, let's move on to the questions. I'm excited. There was one question here that I think that it's very much addressed to you, Antonio. It was, I can't find it now, but it was related to the healthcare comparison between the island Azores, for example, where you come from, the Azores, and the continental Portugal? Is there any difference in your opinion, or not so much?
Let's be frank. I mean, in terms of the quality of the training of the staff and everything, of course, most of them um, they are trained in either in local nursing schools or in the mainland. So, from a training perspective, the standards will be the same. The requirements to the regulations will be the same. Now, of course, depends really on what island you are. I am personally from St. George, right in the middle, uh, and um, and my family have to travel quite often for their specialist appointments. So if they need to see a cardiologist, or if they need to see a dermatologist, they would have to go and stay. If you're planning on having a baby and you are in that specific island, you would have to basically pre-position yourself for at least 3 weeks before your due date to deliver your baby. So just to give you like the care is there, the concept is quite different, and you need to consider the logistics. Then, if you are in a big island, let's say in San Miguel or in Terceira, it's a different story. You have two big hospitals there, right at your doorstep, and they can handle most of your medical needs. When there is not an option, um, they will then follow under the national health system, and they will then bring you up to the continent, to mainland, to have that care. That can happen, for example, in like, for example, for cancer care, for example, or if you need to have like a very specific heart surgery, you may need to come over. um, if it is a life-threatening situation and they need to be moved right away, then of course they will launch an air ambulance and bring you over as well, and that will be all covered by the government. But of course, it doesn't happen every day, and there needs to be a very specific reason for you to come over. But the care is available. Don't take me wrong. It is just need to be prepared for these sort of logistics intricacies that may need to help. Now, again, online always works, so that could be an option for that primary care needs that you may have.
Of course, perfect. Thank you, Antonio. Let's get just one more, of course, I will ask you guys if you can email me and the questions, and of course, I can put you in touch with Antonio as well, because there are many questions. Never saw a webinar with so many questions. If you want to get, we are already, time flies, so it's been 1 hour like 10 minutes ago. So, but we can get just one more just to close up this webinar. Uh, do you want to try, Antonio, to get one of those?
There was someone actually earlier talking about pre-existing conditions in their insurances. Um, and actually, I think that was kind of like an important one, especially I'm assuming that the probably part of the audience are kind of like a bit more seniors. They may have some sort of underlying medical problems, and be sure that when you come over, that your that condition has been covered by your insurance. Um, there will always be kind of like very specific wording that you need to look at, um, and there may be some insurance that will not cover that condition at all. So it's always needing to review. Some of them we will cover all your medical needs except for this element. Other insurers may say we will cover you after you paid into the system for a year, for example. There's apparently one insurance apparently that does that. So it really depends on what it is and what are your specific conditions or situations.
Thank you so much, Antonio. This is Antonio's email as well. Feel free to reach out to him.
Yeah,
You
you have the email. You have as well those slots on the system that I showed. So, they were creative, thinking about our relationship with Viv Europe. They are free, so feel free to book an appointment, and we can have a quick chat and do some sort of follow up if needed.
Thank you. Thank you so much, Antonio. Really, really pleasure having you here. Certainly, it's the first of many times that we'll be together having
I'm
webinar. I
sure.
think this is a very popular topic to talk about. And guys, again, you can please email us, email me the questions. I will do my best to answer you guys. And I do uh, believe that this partnership that we have will last long. And again, thank you, my friend. Thank you, Antonio, for being
No, thank you
here.
for having us.
Thank you, guys. Take care. Bye bye.
Bye.